Some electronic medical record or EMR systems calculate the flow rate for you. To manually check the hourly volume in milliliters, divide the total volume of the infusion by the total number of hours over which the fluids will be delivered. Suppose the healthcare provider orders 500 milliliters of 5% dextrose in water to be infused over 8 hours. To calculate the flow rate in milliliters per hour, divide the volume by duration, that is 500 by 8, to yield 62.5 milliliters per hour. You'll set the pump to infuse at that rate. Insert the spiked end of the pump tubing into the IV fluid bag. Now prime the tubing. Squeeze and fill the drip chamber to force the air out of the tubing. Then open the drip regulator to allow the tubing to fill with fluid. If the patient doesn't have fluids hanging, flush the saline lock with 2 to 3 milliliters of normal saline. Set up the electronic infusion device according to the manufacturer's instructions. Insert the IV tubing into the chamber of the control mechanism and close the door of the control chamber. Then connect the tubing to the patient's IV access device. Press the power button to turn on the device and set the infusion rate to the required volume per hour and press start. Open the drip regulator completely while the device is in use. Label the tubing with the date, time, and your initials according to your agency's policy. If not completed by the pharmacy, label each IV bag, including the type of fluid and any additives it contains, the patient's name, and the date and start time of the infusion. Initial the label if required by the healthcare agency.
Can I get you anything else right now?
No.
Okay.
Instruct the patient to avoid raising his arm, since doing so may affect the flow rate, and caution him against touching the control clamp. Perform hand hygiene.
Hi, Mr. Ferguson. I'm just going to check your IV site here, okay?
Okay.
Check the patient's IV site hourly for complications such as redness, swelling, or discomfort. Be sure to verify that the fluid is infusing at the proper rate by checking the remaining fluid volume each hour.
Okay, let me...
If the alarm on the electronic infusion device sounds, assess the patency of the system. Promptly document any changes in the hourly volume at which the IV fluid is infusing if the healthcare prescriber orders a change in the rate of infusion.